you hear or read about sexual and gender-based violence cases, the survivors hardly get justice or help and are mostly neglected. But this story is different. Some survivors in Sokoto and Lagos states have positive stories to tell on how they triumphed over their issues. And because these are unique sexual and gender-based violence stories, I decided to spotlight them to inspire other survivors that their issues are not at a dead end. Meet Halima Khadijat, a pseudonym. She did not believe she would regain her mental health after a traumatic incident. Halima met a businessman from Kano in Sokoto State. They got married in December 2020 and he returned to Kano State, leaving her behind. A month after the marriage, her parents wondered why she was not with her husband and they called him. He asked them to bring her to Kano State.
On getting to Kano State, he told me he was already in Abuja but provided a place for me to stay. I told my family that the place was inhabitable and they asked that we dissolve the marriage, which we did.
Her brother called his employer in Kano State, narrated her situation to him, and he agreed to keep Halima in his house because she was stranded. 4 months later, the man proposed to marry her.
To convince me that he was serious, he said he wanted to show me the house he had built for us to live in after the wedding. On the day we went to see the house, he gave me a drink spiked with a sleeping drug. When I woke up, I saw he had raped me and he told me not to worry since he would marry me.
2 months later, Halima noticed she was pregnant. The man told her to abort the baby, but she opposed because her religion frowns at it.
I told him I was returning to my parents in Sokoto and he pleaded with me not to tell anyone what he had done and he would continue to send me money. He stopped sending me money, did not visit me at the hospital nor attend the naming ceremony. After the ceremony, I went to Kano to confront him. When I got there, I called him, but he ended the call. I went to his family house and that was where I collapsed. His family took me to the hospital and while I was there, they sent a message threatening to harm me. Then I left Kano State for Sokoto.
When she returned, she left her family house and rented a room with her child. She became mentally unstable. Through the help of a friend who knew her issue, she referred Halima to a group they locally call Human Rights to seek help. In Sokoto State, human rights are community-based organizations, also known as surveillance team. They volunteer for free to serve as first-hand responders in tackling SGBV cases. But this was after they had gone through a training set up by Project Alert on Violence Against Women, an NGO based in Lagos State. The training, which started in January 2020, is under the European and United Nations funded Spotlight Initiative project to eliminate violence against women and girls. This project is aimed at building the capacity of community members belonging to various community-based organizations to be first responders to SGBV cases in their communities as a way of bringing help closer to the people. This is a creative response to the seeming increase in reported cases of SGBV.
Since I came for help, my mental health is better. I have female friends who are survivors. We meet here and the group supports us with empowerment materials to earn money. Now I have hope for a great future. I want people to follow my footsteps and speak up.
One of the local community-based organizations visited in Sokoto State is Freedom for Humanity International Foundation, headed by Hussaini Kwadabawa.
We later discovered that not to punish perpetrator only is the solution for tackling the issue of SGBV, but also to see how the survivors been rehabilitated, counseling, which may help in other people to come out. We record success in which, as you came to our office, you see how people are coming. Even today, that is not working hours, working days. You see how people are coming into this office, reporting issues.
This GBB is happening in a large number. Having no organization that will handle the issue or will help the issue, community didn't bother with it. They didn't take it serious. Getting some organizations who are coming to fight against the problem, people are coming to understand that this thing is bad.
In Rumbuki village is Aisha Mohammed, 16. Her real name is altered to protect her identity. She was raped by a man in her hut, but through the help of a resident in the village who had heard of the exploits of the surveillance team, Aisha got justice after being able to identify the rapist.
The case was reported to the police and the rapist was arrested and detained. For the past 1 year, he has been in prison waiting for the judge to call his case in court.
Aisha was taken to Nana Khadija Center, a sexual assault referral center in the state created under the Spotlight Initiative project to help with psychosocial and medical treatment of abuse survivors.
I was given medication, clothing materials, food items, and money. They also counseled and taught me how to protect myself. I attend monthly meetings with survivors to discuss our issues.
Like in Sokoto State, Lagos in the past 1 year has had one of the highest reported cases of SGBV after deploying similar strategies such as street advocacy in 12 local government areas. From this project, survivors now get justice through the help of International Federation of Women Lawyers, also an implementing partner to provide free legal aid in court on SGBV cases. Beyond the successes recorded, the project has equally faced several roadblocks.
Some of our challenge is funding opportunity. We don't have any organization that is supporting us either financially or technically. So we need such support. So we need capacity building training. At least we need some organization like this organization, this Spotlight, to consider what we are doing in the community, to come in. We don't say just let Spotlight give us money. No, they should hold their money, but give us technical support that will help them to achieve what they are doing. Allow the women affairs to include us, at least in their meeting. We have a lot to share.
Even with the police or the civil defense, a case may take 2, 3, 5 months. You see, this is a lot of time. As far as dispensation of justice to the rapist, for example, is concerned. Now, when they are able to prosecute somebody to court, case in court can be there, like I said, for 5 years. So this is the major issue. If we can have a court specifically that is set up to handle issues of gender-based violence, I think this will be solved. Now, secondly, you have a situation whereby you are into a case. You have put everything. You want to see the end of it, but the survivor or her family will now tell you that, see, we are withdrawing. We don't want this thing to go to public. We have forgiven the person and so on.
In spite of the challenges and with obvious positive impacts achieved from this project, stakeholders hope that their strategies can be replicated across the nation to reduce recurring cases of sexual and gender-based violence.